I'm your Dr. Kola. Welcome to another session of general knowledge as well as biological science topic. Today we'll go through few important aspects and we see that chapter vitamins. You see, first itself is bit. The term vitamins was coined by Funk. Okay, they are required essentially for metabolic activities of our body in small quantities. They not provide energy but control energy yielding reactions of our body on the basis of solubility. సో అగైన్ విటమిన్స్ని మనం రెండు రకాలుగా విభజిస్తాం. ఫ్యాట్ సాల్యుబుల్ విటమిన్స్ ADEK and water soluble vitamins, vitamin B, C and P, etc. So first of all we see B vitamin. In B vitamin there will be a number of things we will see. Vitamin B1 is called thiamine, B2 is called riboflavin, B3 is called nicotinic acid, B6 is called pyridoxine, B5 is called pantothenic acid, vitamin B7 is called biotin, vitamin B10 is called folic acid, vitamin B12 is called cyanocobalamin. So see how within vitamin B itself we have number of things. Okay, so we will see once again. So we will have a detailed idea about vitamin B1. So we can see vitamin B in rice bran, whole wheat, right, flour, yeast, meat, liver, etc. And is a major component of coenzyme carboxylase required for carbohydrate and amino acid metabolism. Deficiency of it causes beriberi disease. Thiamine deficiency causes loss of appetite, vigor, oedema of legs, constipation, weak heartbeat and even paralysis. Next B2, riboflavin. Okay, cheese, eggs, yeast, tomatoes, green vegetables, liver, meat, cereals. Combines with phosphoric acid to form coenzyme FAD, essential for oxidative metabolism. This is important. Riboflavin is essential for oxidative metabolism. Deficiency leads to cheolosis, fissures at the corner of mouth and lips. Regularly we find this type of irritation near around the mouth and lips. Okay, it is very important. Okay, then inflammation of tongue, what we call glossitis, keratosis of cornea, dermatitis, mental depression, scaly, burning sensation in skin, eyes, digestive orders. Next B3, nicotinic acid or niacin. Fresh meat, liver, fish, cereals, milk, pulses yeast. Active group in coenzyme NAD required for oxidative metabolism. Deficiency causes pellagra, which is caused by dermatitis, diarrhea, dementia and death, also called 4DH syndrome. Muscular atrophy, inflammation of gut, mucous membranes, nervousness. B6, pyridoxine, milk, cereal, fish, meat. Okay, important coenzyme required for protein and amino acids metabolism. Leads to dermatitis, anemia. Next B5, pantothenic acid. In all food it is found. Yeast, liver, kidneys, egg. Okay, number of are there. Important component of coenzyme A required for oxidative metabolism. Deficiency leads to dermatitis, gastrointestinal disorders, anemia, reduced secretion of steroid hormones, burning feet syndrome, fatigue, nausea, and then vitamin B7 is yeast and vegetable fruits, wheat, eggs, chocolate synthesized by institution, essential for lipid synthesis and energy production. Skin lesions, loss of appetite, weakness, hair fall, anorexia. Folic acid, green vegetables, soya bean, yeast, liver synthesized, essential for synthesis of DNA and mature blood cells. Retarded growth, macroblastic anemia. Then B12, cyanocobalamin, meat, fish, liver, eggs, milk, synthesized intestinal bacteria, required for chromosome duplication in form of blood corpuscles. Leads to retarded growth, pernicious anemia. This is important, right? Mature RBs as a result of deficient intrinsic factor. Vitamin C, ascorbic acid, in lemon, orange, okay, citrus fruits. Formation of collagen, cartilage, bones, teeth, RBC and iron. This is important. Is also called sailor's disease. Scurvy, healing and growth retardation, breakdown of immunodeficient system, fragile blood vessels, spongy and gum bleeding. Okay, scurvy and bleeding of gums and bones. Okay, is very important. Okay, it is about water soluble vitamins, and in that we have vitamin B and C, and in vitamin B we have seen how many. Okay, it's B1, B2, B3, B6, B5, B7, right? B10 and 12. So please remember, for example, B1 is called thymine, B6 is called, B2 is called riboflavin. Please remember that name also. B3 nicotinic acid or niacin, B6 pyridoxine, B5 pantothenic acid, vitamin B7 biotin, B10 folic acid, B12 cyanocobalamin, right? Vitamin C is also called as ascorbic acid. So remember the scientific names of that one, right? It's also very important, as well as, so in coming to vitamin B is very important. We have a number of vitamin B's, and in that their names and their deficiency leading to what? Okay, definitely sources are number, what will be there, all the same things will be coming out. But what is the scientific name? What the deficiency leads to, right? Then coming to vitamin A, which is called as retinol. It is a fat soluble vitamin. You see, retinol, and another thing is xerophthalmia. Due to non-function of lacrimal gland in connectivity is carried by keratinized conjunctiva. Okay, this is particularly leading to what we say night blindness, which we call nyctalopia, a disturbance of rod vision. Hypervitamin A so results in lack of appetite. Okay, deficiency is xerophthalmia, night blindness, but more vitamin A also leads to lack of appetite and painful swellings of over long bones. Okay, right? So it is found source is liver, intestinal mucous membrane, pigments, milk, butter, yolk, egg or yolk, liver, fish oil, right? The vitamin D, we is also called as ergocalciferol, but purely known as calciferol. It is seen, you can get it from sunlight. It is also called dehydrocholesterol, found in butter, liver, kidneys, egg. Okay, regulates absorption of calcium and phosphate and mineral deposition of bones in teeth. So important is a disorder in children for 6 to months to years due to deficient ossification. And when it is nothing but strengthening of bones is lacking, okay, or osteomalacia, a disorder of adults carried by fragility of bones, right? Hypervitamins results in deposition of calcium in soft tissue. So when we see vitamin A, we have seen their scientific name, as well as what we have seen is that they are what deficiency leads to means less, and if it is more, what it is hyper also we are saying. In vitamin A also we have seen hypervitamin of A results in lack of appetite, and vitamin D results in deposition of calcium in tissues. Vitamin E, green vegetables, is also called as tocopherol, is very important, right? Essential for proper spermatogenesis and pregnancy, lactation and mascula, right? If it is not there, it leads to sterility in female. So that's the main thing. Normal ovulation, fertilization, implantation. So it is very important. Muscular dystrophy, anemia due to increased breakdown of blood cells. So it is also very important. Then coming to vitamin K, phylloquinone, seen in carrots, lettuce, okay, cabbage. See, if this is not present with you, vitamin K, if there is a blood flow injury, the blood will be going on flowing. It will not clot. What we call as anti-hemorrhagic factor, which is required for So, it is essential, vitamin K is essential for synthesis of prothrombin in liver, which is a main item for clotting of blood. Hemorrhages, excessive bleeding of injury due to delayed blood clotting condition is called hyperthrombinemia, right. So, vitamin A, retinol, vitamin D, calciferol, vitamin E, tocopherol, vitamin K, phylloquinol. So, please have a look at all the sources, scientific name, chemical composition, and the difference leading to. So, sometimes there may be a question from this part also, right. Another, you see, we have some important briefs also. Length of alimentary canal is approximately 8 meters, right. Basic metabolic rate, BMR, should be 1600 calories. Number of cells in a body are 75 trillions. Yeah, longest bone, thigh bone. Smallest bone, ear ossicle steps. Weight of the brain, 1400 grams. Blood volume, 6.8 liters in 70 kg body. Normal BP should be 120 by 80. Number of RBC in a male, 4.5 to 5. Female, 4 to 4.5. Lifespan of RBC, 128 days. Normal WBC count, 5000 to 1000 cubic centimeters. Lifespan of WBC, 3 to 4 days. Differential leukocyte content, basophils 0.5 to 1, eosinophils 1.3, monocytes 3.8, neutrophils 49.7, and lymphocytes 2 to 25%. Blood platelet count should be 2000 to 2 lakh to 4000 cubic. In male it is this much, female it is. HB content in blood should be this much. Universal blood donor, O, Rh negative. Universal blood recipient, AB. Blood clotting time 2 to 5 minutes. Average body weight 70 kgs. Yeah. Normal body temperature 98.4 degree to 37 degrees centigrade. Breathing rate should be 16 to 20 per minute. Dental formula 2121 by 2121 When you come to child, 2120 2120 22, then milk teeth. Number of cranial nerves, there are 12 pairs. Right, coming to few important things in the same session. Number of spinal nerves in a human being, 31. Largest endocrine gland, thyroid. Gestation period 9 months, okay, almost 260 to 70 days. The normal heartbeat should be 70 to 75 minutes. Largest gland is liver. Muscle in the body, gluteus maximus. Okay. Longest bone, femur. Muscle, gluteus maximus. Smooth muscle, uterus of pregnant woman. Smallest muscle in the day, the body, stapedius. Largest artery, abdominal aorta. Largest vein, inferior vena cava. Largest WBC monocyte, smallest WBC lymphocyte, greatest regeneration power in liver, longest nerve sciatica, longest cell neurons, menstrual cycle 28 days, menopause 50 years, minimum regeneration power is in brain cells, minimum distance for proper vision 25 centimeters, type of placenta, it is called a hemochorial. Pulse rate should be 72 per minute, volume of semen 2 to 4 ml ejaculation. Normal sperm count 200 to 350 million. ESR, normal erythrocyte sedimentation, ejaculation. Thinner skin, conjunctiva. pH of gastric juice 14, pH of urine 6, pH of blood 7.3 to 7.4, pH of bile 7.5, pancreatic juice 8.5. Number of muscles in the body are 639. Number of bones in the body 206. Largest organ of human body is skin. So viewers, we have seen a number of we have seen fat soluble vitamins and water soluble vitamins, as well as some important points from the biological science. I think this small briefing of a few things in this session will be useful for you. Thank you for watching. Signing off, your Dr. Kola. Bye bye.